So with that, I'd like to introduce Paul Matthews, who's the Chief Technology Officer from OCHIN, and I'll provide a little information about Paul. He brings more than 17 years of experience spanning all major facets of the computer industry to OCHIN. He assumed responsibility for the day-to-day technology standards implementation at OCHIN at its conception in 2001. He's charged with the deployment and integration of health information technology that helps physicians, nurses, and other health professionals successfully adopt health records and achieve meaningful use through software as a service. Paul came to the States after retiring from NATO's Allied Command Europe Communications Security Division, and was once located in Mexico. He started coordinating information technology deployments for a division of an international engineering firm throughout the U.S. and Europe. Paul has worked in engineering, consulting, and banking industries before joining OCHIN as a key consultant in 2001 and later became CTO. He's provided technology review and consultative services to a number of health center controlled networks and independent provider organizations on the deployment of HIT, as well as his participation and leadership in health information exchange initiatives. His current focus is on HIT initiatives through participation on the State of Oregon Health Information Technology Committee, Technology Oversight Committee work group, and as a founding member of the Portland-Vancouver Metro Health Information Exchange. Paul also volunteers his services to the Information Technology Work Group with the Oregon Health Information Network, which is an FCC grantee dedicated to expanding broadband telehealth network capacity to rural communities throughout the state of Oregon. And with that, I'd like to turn it over to Paul.
Excuse me, sliding through your slides here, Walt. Little precursor to the next presentation. Okay. So good morning, everybody. My name is Paul Matthews. Thank you, Michael, for the introduction. I've been working at OCHIN, which is a health center controlled network and a regional extension center in the state of Oregon, for just over 10 years. And in that time, I would say that we probably never stopped implementing electronic medical records. We've been growing continuously, and we now cover a number of states. So I'm going to jump right into a little bit of the history here. We were formed back in 2001 under an initial CAP grant award, and we're charged, I think, with like $1.5 million to implement 500,000 visits annually on an EHR practice management system. No way of doing that for $1.5 million. So within there, we basically went out, formed a not-for-profit organization called OCHIN. We were born out of a Medicaid payer in the state of Oregon as a division of that organization originally, and then formed the Health Center Controlled Network back then. And did that as basically to transfer quality. Not only were we seeing an issue of networks having historic medical record systems or practice management systems that were dying, were being continually bought out and sold by vendors, and the clinics themselves could not continue to maintain those infrastructures with continual change. So OCHIN was basically, or kept the original home, was approached, asked if we would form an alliance of clinics, and that's what became the Health Center Controlled Network called OCHIN. We also have been awarded, as was mentioned, the Regional Extension Center for Oregon, and that occurred in a large part. We're partnering with Oregon Health Science University, which is our key partner in that state. We're providing the implementation and the home for the Extension Center. OHSU is providing a lot of the clinical background and content for provider training. So a quick view of where we are. OCHIN currently is in 5 states, actually 6 states as of last week. So continuing to grow. You can see we have a lot of penetration in Oregon. Just started up into Washington in the last year. Through California, Wisconsin, Ohio, and this last week, we entered into North Carolina contracts in North Carolina. And so continuing to grow. From the population that we're serving, we can see that we've been adopting medical records. Our electronic medical record system was actually built on top of our practice management system, and that started off at the end of 2005. In 2006, we basically were starting to expand those services after initial testing and ramp-up phase, and since then we've been expanding continuously. The numbers of sites that we're actually serving with that across those states has also exponentially increased. And to date, we're actually serving 37 contracted organizations. I think it's about 130 sites itself across the country. From our demographics, we are definitely serving the underserved populations within those states. We are concentrated on FQHCs, CHCs, public health departments, city health departments. We have some hospital-based organizations, but we provide only the ambulatory services, not the inpatient services. From our work in the implementation of EHRs, we always say that people always say, well, we've implemented our EHR, where do we go? Well, once you get past your implementation of an EHR, or even in the planning stages, the most important thing is, where do you want to take that information? Are you going to be using it for research? Are you going to be using it to do improved outcomes, health outcomes for patients? Is it about the reduction of cost or the ability to keep those clinics funded? And so OCHIN's major focus has been on how to provide continual funding, continual support, bringing additional capacity into those clinics, and not necessarily about just the implementation of an EHR. That's the 6-inch high jump. The actual work that surrounds the EHR is the actual difficult work. So with that, we've expanded our services. We were awarded, 2 years ago, HRSA awarded us an innovations grant. We've done behavioral health and mental health for specialty mental health integration into the primary care setting. That's also used in a medical home model under one of the Northwest grants from Qualis. We're integrating electronic dental records. We have all kind of capability connected currently to one product vendor where we're interfacing the solution. We're just finalizing our RFP and demonstrations for our membership to look at the adoption of a hosted dental solution. And the goal there is not just to host a product, but actually to integrate it into the primary care setting. How do I make certain that a doctor is not prescribing something that is going to go against what a dentist is prescribing in their clinic? So we want to make certain that both the medication information is consolidated and is actually captured in real time. We've actually implementing this year, we'll be implementing kiosks in the clinics. The goal is to basically get the patient through the door, have them checked in, and to be able to have the staff concentrate on making sure eligibility is checked, making sure that they're not having to ask every question of the patient. Do some pre-screening of the patients before they actually get into the clinical visit. And this will especially help with those that we're basically bringing in new patients and bringing on patients into the system that have never been seen in that organization before. We also hosted the last 2 years, we've applied again this year, we haven't been told we're not doing it yet, the HRSA's National EHR Workshop Conferences. These are independent conferences, they're non-vendor specific, to teach organizations of any providers what to think about when contracting, purchasing, implementing EHRs, what to look for in the infrastructure that you need to implement, how to implement in multi-site versus single-site organizations, because there's large differences in the infrastructure you need to actually do that work. And then we are also doing a number of other systems that have gone live. So the Health Information Exchange work, we're live and actively doing Health Information Exchange today across all organizations that are using our EHRs. And we're also a Social Security Administration contractee, one of the 15 awards from last year that awarded to do NHIN connectivity for disability determination. That work is progressing and we're hoping to be live in December with that work. We also have a large practice-based research network, and I'll talk a little bit about the practice-based research network in a second. So one of the things that I look at when I look at the health center control network market is that we bring to organizations is not just the focus on buy an EHR and install it. It's about the continual improvement of those systems and the expansion of those services. And so one of the things that we've been doing is Ocean is actually transforming itself from an implementation shop into a quality and research shop. We've got a lot of AMI quality or API quality improvement advisors, where actually all of our staff are going through training at every level of staffing, executive to line staff, to become quality advisors. And the idea being is that the same training programs that are being offered through IHI are also offered through our organization, through our extension center. We just reached stage 7. The announcements came out from eHealth initiative in their annual reports. So we're stage 7 of the health information exchange criteria they set out. This is a self-reported report, so I get to fill this in every year. So the idea is that this is an expansion of services beyond our initial organizational initial partners. And so we've been participating very heavily in the State of Oregon Health Information Exchange work group to set the direction for the State of Oregon, and have also been collaborating in California and the other states to make certain that the health centers that we operate or function with in those organized states, that they're actually getting to do true HIE, not just the discrete interfaces for a lab provider or for a registration, but actually exchanging care summary records in real time between the hospitals, the clinics, the specialties, and the referral practices. So this is our vision. A little plagiarization from a presentation from the Social Security, but it's a very, very powerful slide when you actually talk with organizations about what health information exchange is. And when we look at health information exchange within the health in a controlled network, our biggest issue is getting past the conversation of, but these are our competitors. The clinics themselves, the providers, definitely are interested in health information exchange. And I've not had a single provider in any conversation that I've been involved in that has said, we don't want to exchange information. It is normally the financial barrier or the concern about loss of market from the hospital or from external providers that we have to deal with and are concerned with. But from the provider side, we're finding that our providers are very happy with it. Once we turned it on and they started using it, the feedback from the providers is that they would never go back to a paper or fax-based method. So this is real-time integration directly into the workflow of the provider. So they don't leave their EHR to exchange records. They're doing it within the electronic record itself.